Dr. Drew said this about the coronavirus. He says that the media is hurting people and they need to be held accountable for causing panic. That's what Dr. Drew had to say. Meanwhile, ABC News is asking the question, does worrying increase your risk of getting sick? So, all right, whether it's Dr. Oz, Dr. Drew, hey, who needs all them when we got Dr. Scott Sears, St. Vincent Healthcare, here with us in studio. Well, Doc, what's the last couple of weeks been like,
lots of questions. I find that fascinating that people in the media start to bash people in the media.
Yes,
like Dr.
exactly.
Drew makes money in the media. You're part of the media. So it's fascinating to me how we tend to just use everything as an opportunity to bash somebody else. Someone's trying to prepare for an illness and someone else is criticizing them for trying to prepare and says they're creating hysteria. And so I think that's been what the last 2 weeks is like, right? People who are starting to feel hysterical and panic because they don't understand what's going on and they don't know what to do to prepare and they don't know whether they should be taking the trip that they had planned. And other people are just minimizing it and kind of living in a world of denial. And all of us are intermixed in the same community. And so we see all of that.
Yeah.
With questions people have.
There does seem, where is the line between preparedness and panic? Because it does seem some folks deliberately want to stir up some panic out there in the midst of all this. Because like when you and I first talked about this, it's like, hey, folks, wash your hands. Those little masks aren't going to really help you if you're still touching your face and everything. Just wash your stinking hands. Yeah,
it's so many of the things that are important to do right now are things we've been talking about for years. Infectious diseases, this is not the first time an infectious disease has come across, our community. Influenza comes every year. We have coronavirus outbreaks every single winter with colds and flus, just different coronaviruses. We had the measles last year that we talked about. So we know how things can be transmitted. Now, when something pops up new, it does create a feeling of panic in people because people wonder, how do I get this? Do I get this by being in the same room with somebody, by breathing the same air as somebody, by shaking their hands, by hugging or kissing them? Is it sexually transmitted? It's really important for epidemiologists or those professionals who study this, public health officials, to know how are things transmitted, because then it allows us to give good counsel about how do you avoid it. With coronavirus, I think people are aware it is passed by secretions. So someone who has the illness has secretions. It's passed through breathing secretions. So it's not just breathing in the same room. I can't be in, if the superintendent who was here a half an hour ago had this and now I walk into this room a half an hour later, it's not circulating up in the air in a concentration enough that I can get
going through the ventilation system.
Right.
Because with something like measles, that would be the case.
Absolutely.
That's
measles
how dangerous
is airborne.
Yeah.
But this is respiratory secretion. So if I was sitting next to the superintendent and he had it and he sneezed in my face, or if he wiped his nose and then shook my hand and then I used my hand to scratch my eye, that's how this is transmitted. So you really need to be within 6 feet, close contact with someone who actually has the virus and is shedding it for you to get it. And that really helps people understand, well, what precautions do I need to take? Washing hands, stop touching your face, avoid shaking hands and giving hugs, use more of the air fist bumps. Those things do make a difference.
Josh in Billings, great to hear from you. Did you have a question or comment for Dr. Sears this morning?
Yeah, I do. Thank you for taking my call, Aaron. I appreciate it. I was wondering, so the president tweeted yesterday that 37,000 Americans die from the common flu, yet nothing is shut down. Life and the economy go on, and only 22 people have died from the coronavirus in America with 546 cases. So it gives kind of the impression that maybe coronavirus isn't as serious as the common flu. Is that correct?
So this is a really good question, Josh, and I appreciate you bringing it up. And I think it's important that we don't, we oftentimes try and minimize the seriousness of one illness by comparing it to another illness. And the truth of it is influenza and coronavirus are both serious illnesses. And I don't want to minimize the seriousness of the flu by elevating coronavirus and vice versa. I don't want to elevate coronavirus by minimizing the flu. Influenza has been around for a long, long time and has killed millions of people. Millions of people, and it kills thousands of people in the United States every single year. Influenza is a serious disease. When you get influenza, your risk of dying from it is about 2 in 1,000. Right? That's maybe even slightly less than that, 2 in 10,000, right in that range, between 2 in 1,000 and 2 in 10,000. With coronavirus, particularly if you're older than 60, your risk is 2 to 3%. That's 2 to 3 per 100. So if you were going to choose which illness do I want, I would probably choose influenza, because getting influenza, my risk of dying is lower than if I get coronavirus. However, so many more people have influenza. More people are going to die of influenza than die of coronavirus. The problem becomes this. Right now, coronavirus has a pretty low total number of cases relative to the total population in the United States. If it hits epidemic status, particularly in some of these big cities, LA, New York, Chicago, San Antonio, Houston, then all of a sudden you increase the number of people who get exposed to it. And because the mortality risk is so high getting coronavirus, the number of deaths is going to go up significantly. So both are serious illnesses. The biggest difference is influenza, you can protect yourself with a vaccine, and it's readily available, and you can walk into the pharmacy in the next 5 minutes and get it. And too many people are not getting it. And at the same time, they're clamoring for an immunization against coronavirus. So do what you can for influenza, get the vaccine, and follow the same precautions that you're going to follow for coronavirus, which is wash your hands, stay home if you're sick, avoid close contact with people who are sneezing, coughing, have runny noses.
Well, and is it already on the downturn? Is it already starting to subside in places like China? I know that's one of the questions one of our, we've had over the past couple of days. I do want to go back and see. I don't know if Josh is still on the line. Josh, did you have a follow-up question for the doctor? Yeah, go ahead.
I do. So I'm just, are the extra precautions that are affecting the economy, are they necessary for coronavirus? I mean, it seems like we're reacting more to coronavirus than we do the common flu, and the president is certainly pointing that out, that maybe we're overreacting by having quarantines and such.
Yeah, I think that's another great question, and I think there's really two ways you can ask it. The real question in my mind is, do we underreact to the flu? So are we acting appropriately to the coronavirus, and we've just been underreacting to the flu for years and years? The reason there's a little bit of what some people would call hysterical response or a panicky response to coronavirus is because it's unknown. Right? We know a lot about influenza. We know it mutates year to year. We know the months of the year that we tend to experience it in our communities. We tend to prepare a little bit more during those months, watch out for it a little bit more during those months. A lot of that stuff is still just unknown about coronavirus. So most coronaviruses are winter viruses. They come in the cold season, and they tend to go away as the spring comes. So our timing might be good in the U.S. if that pattern holds true. The problem is because it's a brand new virus and no one's seen it through a year or 2 years, we just don't know. Is it really going to dissipate as the cold weather subsides, or is it going to persist? And because those things are unknown, it creates more panic.
Yeah, so Dr. Sears, I guess the point being that by and large, life is still going on as normal in Montana. We aren't seeing what these other states are seeing right now, but it's really a question of when coronavirus shows up in Montana and how bad will it be. But right now, at least, other than I know the CMR, the Charlie Russell Museum in Great Falls, is postponing one of their big events, but other than that, hey, all these other big events are still moving forward right now. And do you think that's a good thing that they're still moving forward at this point?
Yeah, I mean, I think that there isn't any documented cases in the state of Montana right now. So going to a big event right now, your risk of getting coronavirus is extraordinarily low. Your risk of getting flu is relatively high. We're still in the midst of a flu outbreak here in Billings. And so just because coronavirus isn't around doesn't mean you should just be blissfully ignorant to the people around you. So what I'm telling people is there's no reason to change your current behaviors. You can still go shopping. You can still go to the Alberta Bear. You can still go to the Metro. You can still go to church. But be mindful of people around you, just like you always should be, right? Like if they're sneezing, coughing, runny nose, then you should avoid contact with them.
Is there a chance that some people that thought they had the flu in February or January here in Montana may have actually had the coronavirus and gotten over it and didn't even realize it?
So that's certainly possible. I would say it's much more possible that they had a different version of coronavirus. We have 2 strains of coronavirus going around right now in the community that are not the novel coronavirus. So it's possible, but it's unlikely that people have been exposed to it here in the Montana community. Much more likely that they had some of these other viruses. In fact, when people come in with viruses right now, unless they've had a high exposure risk, so they've traveled to China, South Korea, Italy, perhaps Washington State or California, we really would test for influenza first with the swab. We can do a rapid flu test and have the answer almost immediately. And if you test positive for flu, you don't have coronavirus. We also have a respiratory panel that we can...
So that is your test kit then?
That is the first test kit. Okay. Now, if someone has high risk, right, they've traveled to one of those areas or they've had close contact with an individual who has known or probable coronavirus, then our state... we can send to the state lab and do coronavirus testing, but you need to have symptoms and a higher risk of exposure. If you're lower risk, we'll typically run a flu test first. We'll ask people to self-isolate themselves at home. In fact, we have over 200 of our providers at St. Vincent wired with iPads in their office. So if people call in and have symptoms and even a low risk of exposure, we're encouraging them to do video visits. So we can have people just pull up their iPhone, log into the app, and do a video visit with us in our office. And they don't have to come into an office where there are sick folks or bring in their illness to the office and expose others to it.
Which is good, because I mentioned the Unified Health Command, at least out of Billings, and I know there's probably similar efforts taking place in the Flathead and elsewhere across Montana, but where they basically are requesting that healthcare facilities restrict visitors. So that's one way you can still be seen without having to be there in person and clog up these facilities and potentially expose people to flu
Absolutely.
Or anything else that's out there. All right, we got more callers on the line here, 406-294-0970 on our Parsec data management phone lines. Tony in Billings, did you have a question or comment for the doctor?
Yes, good morning, Arian, and appreciate the doctor being in the house. But I was wondering if there's any nutritional intake that we could do to help prevent us or fight the virus before it ever happens, personally, to build up our immune system.
Foods you can eat, things you should drink. What can you do from a nutritional standpoint, whether it's flu or coronavirus?
Really good question. And I think particularly with coronavirus, and if you get onto Facebook or you get onto any social media site, you're going to see all sorts of companies advertising silver and other products that they say kill the coronavirus. And actually, they were warned yesterday officially to take that down because there's a lot of false information out there. Just like most viruses, there's very little data that vitamins or supplements can make a difference. I will always give a plug for fruits and vegetables. Excessive fruits and vegetables or excessive vitamin C is not going to fight an illness. But if you're deficient, so if you're not eating fruits and vegetables every day, then supplementing with a vitamin can be helpful. But it really only works in people who are deficient in vitamins, which shouldn't be any of us because we should be eating our fruits and vegetables. There is data, if you look in microbiology labs, zinc, and we've talked about this before, high concentrations of zinc actually have been shown to kill coronavirus in a lab, particularly coronavirus. Not this new coronavirus. Nothing's really been looked at carefully. It hasn't been around, but other strains. I wouldn't say you need to go clean off the shelves at Costco or Sam's Club of zinc lozenges, but that's probably the only thing that's ever been shown in studies to actually make a difference.
Because zinc is basically I'm forgetting the name of the orange and white product. Zicam. That's basically what Zicam is.
Is zinc. And the thing is, in the studies, you have to have such high concentrations of it. It's really hard to do that consistently over a long period of time to actually make an effective difference like you can do in a lab.
And I keep sitting here like touching my face, touching my microphone. I failed the first test too. Doc Sears walks in this morning. Hey, Doc, I shake his hand. It's like, I just failed the test. Dang it. That's all right. I think he's clean. 406-294-0970 if you want a clean shot here to ask the doctor a question or jump in with a comment. Let's go next to Robert in Billings. Robert, did you have a question or comment for the doctor?
I do, Aaron. Good morning. Good morning, Dr. Sears.
Morning.
I read in the Gazette this morning, now one of the precautions they're going to take out at the tournament is that instead of the traditional handshakes, they're going to do the elbow bump. So what I'm wondering is during the game then is every time you pass the ball, what are they going to wipe? They're going to sanitize that ball before you pass it off? Because it seems to me that I see a lot of going to the mouth, touching the ball, shooting. I see licking the bottom of the feet. So I just don't understand that this is relevant that they go, yeah, let's do the elbow bump, and then we'll prevent anything from going on. And I will get off the line right now, and I want to hear your comment.
Robert, I got to ask you real quick, were you an 80s kid?
No, Aaron, I was not.
Oh, okay.
I was a 70s kid.
Oh, okay, good. You got me beat there. Well, because my wife joked, and she was like, you know what? I grew up in the 80s. I drank out of the hose, so I think I'll be fine here. But, 80s kids, I think we can survive almost anything. I think
80s kids were exposed to just about everything.
That's right.
Yeah, but I will say, I will agree with him that licking your hand and then rubbing the bottom of your basketball shoes and then licking your hand again and rubbing your other basketball shoe on the bottom is probably not advisable for any reason, coronavirus accepted. And
I just
but it's a good point.
Spit on the floor and then wipe your shoe on it. That's what I did when I played basketball.
Yeah, and I think really what the Gazette's getting at is not so much the players on the court. Number one, if a player is sick, they shouldn't be playing. And coaches should know this and parents should know this, just like you should not send your kid to school with a cold. If they're sneezing and have secretions, you are doing the public a disservice by sending your kid to school. And it may be a little more inconvenient for you, right? But you're exposing lots of people to whatever virus that is, right?
And it's tough
lots
because,
of winter viruses.
Then you can't put them in a daycare. Now you got to take time off of work, and then you got to get the doctor's note. But
it's a big deal. But you cannot send people out. So you shouldn't be sending an athlete out onto the court that has secretions, because when they do touch the ball and do pass it, you are going to spread it. Now, what they're talking about with elbow bumps is in the stands, right? In the stands, all kinds of that garbage goes on. Buffalo Wild Wings, their commercial is everybody's high-fiving and hugging people in the restaurant. They don't even know each other. Right, that sort of behavior.
Hey, don't judge us now. We love our wings.
We should be a little more cautious about slapping high fives and shaking hands and giving hugs during this time of the year.
Got another caller on the line, Fred in Summers, listening to KJJR. Fred, did you have a question or comment?
Yes, I do. I just heard the doctor say that part of the reason for the panic is because the coronavirus is unknown. But back in 2009, the H1N1 was also unknown, yet we had 60 million cases in the U.S., 12,400 people died, and there was no panic. How come? It was also unknown at the time.
Oh, interesting. Oh, yeah, H1N1, SARS, Y2K, all these different. Of course, that wasn't medical, but either way, yeah, good question.
Yeah, no, great question. And again, I would say that are we overreacting now, or have we just been underreacting? And H1N1 is an influenza virus, and it wasn't as unknown. It was a different strain, but we have lots of strains of influenza, and it still followed the general pattern of influenza. Does that mean that we certainly didn't react to this level? Right? Absolutely not. But back when SARS came out, this is a version of SARS. SARS was a coronavirus. There was a level of panic, but it didn't seem to have this rapid spread around the globe as quickly as this one has had. So again, I'm not saying that we're inappropriately overreacting right now. I think we have been underreacting for a long time, and in the long run, this may be a very good thing for people to understand how important it is to do hand hygiene and public health. We have become such a global society that the risk of transmitting an illness from China to Billings, Montana is a very real thing now.
Yeah,
and 20 years ago, it was not as high risk.
Especially the Flathead, too. You got Glacier National Park, and all the
and you and I have
tourists
talked about this. I commuted for 5 years back and forth to Seattle with my job and lived in Billings, Montana. That didn't happen 20, 25 years ago. We have such a global workforce now that the risk of spread is real. So again, are we overreacting a little bit? I think the economy is overreacting a little bit. I think some of the media can be overreacting a little bit because it drives ratings. But I will never underestimate the risk of an infectious disease.
I know we got one more caller on the line from Kalispell, but we are unfortunately out of time. But Dr. Sears, with the 30 seconds or so we got left, what else are people asking you about at the hospital right now?
Right now, people are just asking about respiratory illnesses at the hospital.
Really? Okay.
This is on people's mind. It's consuming a lot of leadership, and it has to do with preparedness, right? We don't want to be hysterical. We're reassuring patients that they should go about living their life using common precautions and reaching out to us when they have questions, instead of Googling things all over the place. Just call the office, set up a video visit if you need. You don't have to come into an office. Great resource for you.
We'll take Dr. Sears over Dr. Google any day, and it's so great to have him every other Tuesday here on Montana Talks. Dr. Scott Sears, St. Vincent Healthcare, great to have you. Thanks for joining us.
Great, thanks.